All right. So the average person is they would love to be able to pay cash, but we all have to jump in the same pool together so that we can kind of, what is that doing? That's dispersing. What is that doing? Right.
Yeah, good question. So, I mean, insurance in its purest form, the definition is basically that, insurance is used to protect against catastrophic, unpredictable loss, right? And so health insurance actually is an insurance. There's an insurance component to it, which is known as reinsurance, which you don't see as a consumer, but you're buying it every year. Your employer's buying it every year, whether they know that or not. It's baked into these products.
Okay.
But a lot of what we consume is actually predictable. 80% of what we consume is a predictable, low cost services. So, like for example, I just I turned 45. I've never had a colonoscopy, and I've been paying cash for years. Um, and so I go and buy the colonoscopy, and it's $1,400. If you just pay cash. But if I were to go through my insurance company, their negotiated rate would probably be around $3,000 at the same place.
Right. But you would pay the copay, not the full $1,400.
Yes, yes, but here's the thing. Like, a lot of employees have been pushed into these high deductible plans, these HSA plans. So basically, they don't have any. The plan doesn't actually pay anything until they hit their deductible, right? So I'm
Yeah.
not saying everybody should go cash pay. That's not what I'm promoting. And there's, I mean, seriously, Jake, there's no silver bullet. Everyone has their own needs. There's a million products in the market. And there's no silver bullet that's right for everybody. That's off the table. I mean, think about it. We have 500 different kinds of cereal in the grocery store,
Yeah.
right? This is America. We love choice. But but let's get back. At the end of the day, what employers are doing is they're delegating the management of their healthcare supply chain to entities who have no actual financial incentive to maximize their investment. They have no incentive to manage that healthcare supply chain well. And so 80% of businesses right now use a big three pharmacy benefit manager to
Okay.
help them manage their health, their drug supply chain. But the big three PBMs, they're supply side vendors. They make money off marking up the price of the drugs for amounts that you'll never know. Okay,
Okay.
so go
So
ahead.
just real quick, so we can, all right. So 85% of every dollar needs to go towards healthcare. Got it.
Yeah.
So it benefits the insurance company to raise those prices so the 25% that they get to keep is more.
Yes.
All right.
Bingo.
Yep. And then so because those costs get inflated, the 25% of their, because they want to make more money, they keep 25%. That spills over into the pharmacy. The pharmacy then marks up their costs or their, would you say, the big pharmaceutical
The
distributors?
pharmacy benefit managers. Yes. So
Yep.
they're making so not only are they making profit off of that, it's actually 15%. But they're making the 85% on the supply side, the actual services,
Hmm.
they've got revenue streams within that 85% that don't count towards the medical loss ratio rules. Okay. So we're going down. Yes. Yes. Now you get it.
That's funny. Okay. So you have, so all right. Because this is complicated. Like insurance is complicated, man. I mean, it's just like it fries my brain every time I try to talk about it. And you're making it pretty simple, and it's still kind of just it's like ones and zeros, right? They're just I just all right. So 85%, boom, um, goes towards medical care. That's a law. 25% gets to go to the insurance company. Within that 85%, there's some things that are just chipping away that are not directly associated with the medical care, the MRIs, the X-rays, the farm, whatever. It's so
Yeah,
there's other things that
they're marking up the price. I mean, this is one of the reasons that they created all these PPO networks. PPO networks, it's not like we act like PPO networks are like etched in stone.
mhm,
Like you can't not have a PPO. They're relatively new. They've only been around for like 40 years.
yeah,
Okay. So and the carriers did this because they could obfuscate what the prices are and then actually start spread pricing, marking up the cost of the care and making money off of the care itself.
So yeah. So then so as then they begin and they figure out how to whittle away the 85% that's supposed to go to care, um, it fades into some broom closet somewhere. So maybe 5% here, 3% there, maybe some kind of nuisance percentage that nobody will ever miss. That means that the end dollar amount that gets to the actual care is, what do you think it is? Like it's not
Oh yeah, I
85%.
mean, it's amazing. I mean, people are shocked when they. I mean, this stuff is like the Matrix. Once you see it, though, Jake, you can't unsee it. So
Is
to
it
answer your question, though,
40% though?
well, yeah. So great question. So there are studies that showing that physicians are only getting 27 cents on every dollar spent on primary care. So you spend 150, like a primary care visit generally costs about 150 bucks, right? I don't
Yeah.
care where you go. It's about 150 bucks. The physician's only getting 27 cents of that. The rest is going to all this administrative stuff and these middle layers that don't add a whole lot of value.
Well, if he gets 27%, I mean, just and your copay is $100, does that mean he gets 27 bucks?
Yeah, and that's why they have to do 20 visits an hour. Or whatever it is. Like, I mean, it's
Yeah,
like
right.
you're getting 8 minutes with your doctor for a reason.
Right. And they don't listen because they're just, yeah. And then what are they going to do? Oh, your ankle hurts for some strange reason that it's never hurt before. It's probably a strain. Here's a pharmaceutical of some
Right.
sort.
You're exactly right, Jake. So when they don't have time is the secret ingredient here. And when they don't have time, they resort to sending you to high margin services known as specialists or other cures that may not be so effective, like take this drug, right? So time is the secret ingredient. And really, some people like to dunk on the clinicians. They're just trapped. Many of them are just trapped within a system. They're
Yep.
doing the best they can
That's
within a
right.
system, the medical industrial complex that does not support the goals of their clients in many ways. So I don't blame the physicians at all. They're getting a short end of the stick on this as well. So listen, I mean, we've gone down the rabbit hole right off the bat, but I
Yeah.
would love to just give some more clarity on the actual how employers buy healthcare. What is that process like? Because this is the opportunity that's right in front of businesses right now.
Yeah.
Understanding how to buy things, right? Who does what and why.
Okay. Go for
Yeah.
it.
So most finance teams have no technical expertise in healthcare financing and procurement. They don't know anything about this stuff. Okay. And it's not their fault. Like they've got their own job, right?
Yeah.
Most HR professionals have no technical experience in healthcare financing and procurement either. And they have a million other things that they have to do. Okay. Here's another piece of important context. The insurance industry has been masterful in lowering expectations amongst employers for years. And so basically they said, listen, healthcare costs just go up every year, and there's not a whole lot you can do about it. And so what executives have said, you think about it, you're a busy executive. Well, geez, if there's nothing I can really do about this, I don't need to be in this meeting anymore. You know what? HR, you go deal with it and tell me
Yeah.
what you think is the best track. Right.
Yep.
And they're like, well, they're not financial people. So they don't have really visibility and that kind of mindset in many cases. So basically, they rely on their benefits broker to help them navigate and understand which products to buy. Here is the challenge, though. Brokers don't work for them. You're
Who does
you're
brokers
relying
work
on
for?
commission. Yeah, you're relying on commission salespeople to give you financial advice.
I mean, that seems obvious, but when you say it out loud, it's kind of like, oh crap.
Right, exactly. So like, just for example, like, I started my management consulting firm in 2018, and I don't want to have to pay attention to US tax law, which seems to change every few months. I don't know anything about it. I don't have the bandwidth for it. Like, it's just not that important to me.
Yeah.
I hire a CPA,
Right.
right? I hire a CPA, a subject matter expert, they live and breathe it, they love it, that's what they do, and they protect me, right? But imagine in this, to use a metaphor, imagine if that CPA got paid by the IRS behind my back. I would undoubtedly end up paying more in taxes than I should, right?
Yes. Yeah.
But
Yep.
yes, yes. So, but when we're talking about a business's second largest expense, their healthcare spend, this is exactly what's going on. You're asking the fox to guard your hen house, and it's not sustainable. It's
Right.
no wonder that businesses aren't being shown the plethora of ways to buy healthcare more effectively for their employees. They're just being shown a small sliver of solutions and saying, "Hey, here's the best worst option."
Yeah, that's like getting, that's like getting your investment advice from somebody, from um not to crap on Primerica. They're huge, but if you're getting your financial advice from somebody who works for an organization like that, then you're getting financial advice from somebody who is trained to sell a specific package
Yep.
of investments, whether it's treasuries or bonds or whatever. And so then you go, oh, this guy knows his stuff. He's going to sell me this, when what's removed from that package is a litany of other much better investments
Mhm.
that this guy has no clue about, because
Yep.
he only sells, let's say in this case, Primerica properties. Right. So as a broker, you guys do the same thing, right? Where you're going to sell the packages that earn the biggest commission.
100%. And I have a chapter in my book. Here, let me pull this up right here. Yeah. Again, coming out November 12th, Fixing Healthcare, How Executives Can Save Their People, Their Business, and the Economy. And I have a chapter in the book on the history of this industry, because this is super important. You have to understand, hospitals actually put up the seed money to create health insurance companies in the 30s to stabilize their revenues. They didn't. So health insurers are wholesale suppliers of hospital services. That's what they do. They sell hospital services in a prepaid financial package. Okay? That's what it is.
Okay. So I don't,
Okay,
I don't
go
know if
ahead. Go,
everybody
go, go,
got,
go.
I don't know if everybody got that right. So, all right. So the insurance companies, what you say is, uh, clarify, insurance companies put up the seed money for hospitals. And
Hospitals put up the seed money to create health insurance companies in the 1930s, and that's what became rebranded as Blue Cross throughout the 30s.
hospitals put up the seed money to create insurance companies.
Yes,
And so then the insurance company became the sales arm of the medical services.
exactly.
Got it. All right. God bless. Okay. So, yeah.
Okay, Jake, that's part one. That's part
Hmm.
one. Here's part two of that distribution channel.
Hmm.
Okay, so you've got the insurance companies are wholesalers of
Yep.
hospital services. Brokers are the retail arm of this distribution channel, right? Brokers sell health insurance products. Okay, so they're
Okay.
by proxy, they're selling hospital services. Okay,
Right. And the
this is
brokers work for the insurance companies.
yes,
So you
they
have
get
the so you have the
yep,
hospital that put the seed money in for the insurance to build the insurance companies, which is basically the sales arm of the hospitals. And
yep,
then you have brokers that work for the insurance companies. Those are the independent salespeople. They're
yes.
hustling to sell whatever packages those insurance companies put together for those medical facilities.
You
Got it.
got it. You,
All
you
right.
articulated it better than anyone I know.
A linear thinker. So I'm trying to put the dots together for people so they can track this, where the money flows or whatever, where the intentions are, I guess.
Exactly. So because the net result of this is that because hospitals, insurers, and brokers are all on this are also supply side vendors, they all make more money when costs go up, not down.
Yeah. Right. Well, because I mean, I have commission salespeople, right? We all, and the whole industry that I have aside from this podcast is built on commission salespeople.
Mhm.
Yeah, obviously it makes more sense if we can sell high dollar services, assuming now in our world, it is the value has to match the price. Otherwise, people won't buy it, right? I mean, you can't go above market value that high. Your services aren't twice as good or 4 times as good as anybody else.